Hi there, and a hearty welcome to my channel. My name is Dorothy Iso, and I am from Dr. D underscore PhD. If you are new to this channel, please do me a favor, hit the subscribe button and the bell icon next to it, and be the first to know when I upload my videos on a Monday, Wednesday, and a Friday. Today's guest is Stacey Chanquin. Stacey is a sessional clinical psychologist at the University of the Western Cape. There they assist students with academic, emotional, and psychosocial problems. Now, in this time of pandemic, we've all been through some kind of trauma. Many times, people do not realize that teachers carry this weight on their shoulders of their learners and their well-being. Let's hear what Stacey has to say about taking care of ourselves during times like these. Hi Stacey, and a warm welcome to my channel.
Hi Dr. Iso, thank you for having me on your channel.
So Stacey, I know that you are currently employed at the University of the Western Cape within the student support services as a sessional clinical psychologist. Please tell us a little bit more about yourself and what it is exactly that you are doing.
Okay, thank you. Well, apart from being a professional, I am a wife and a mother to two small, beautiful girls that are keeping me very entertained and busy during lockdown. And yes, I am a clinical sessional psychologist at the University of the Western Cape. I completed both my undergrad and my master's degree at the university. So I feel quite blessed to be in a position where I am able to work very closely with students and to contribute to their development. So as a sessional, it basically means that I work part-time, and one of the duties or the services that I perform is providing counseling to the students at the university, whether it's first year or right up to postgrad. And our students present with a wide array of conditions, so it's really just providing counseling for the academic, the emotional, or other psychosocial difficulties. And I'm also fortunate to be in quite a supportive team of other psychologists, interns, and social workers, where we continuously stay up to date with the latest developments in psychology, and we also just provide a lot of peer support and peer supervision to assist with our clients as well.
And Stacey, not to go into the confidentiality of your clients, but at this time, what are students going through? What do you pick up from what they are going through in this time of separation and lockdown and missing out on academics? What do you find with them?
Yeah. Well, there's a lot of anxiety, of course. I mean, we ourselves are quite anxious because because of the amount of uncertainty. But for many students, there's increased anxiety. There's lots of concerns about missing out, not having data, not having access to technology, and also just not understanding the content. I think it's been a huge adjustment for many students having to suddenly learn online, and some students perform better if they are in a situation where they've got the lecturer in front of them and they are able to interact, but also able to interact with their classmate. So I suppose the lack of access to resources, library books, internet, it's providing a very stressful and very anxiety provoking time for many of the students.
I can only imagine. So you are, like you said, a sessional clinical psychologist, and you work with students. And I know there are different streams of psychology. Can you just highlight the differences between the various types of or streams of psychology out there?
Okay. So yes, I am a clinical psychologist, and we have in South Africa we have 5 different streams, being clinical, counseling, educational, research, and industrial psychologist. And the difference is in our training. As for clinical psychologists, we have to do an additional year of training, working in a psychiatric unit, at places like Falkenberg Psychiatric Unit, Lentegeur, or Children's Hospital. So we have an additional year of training, and we specifically trained in psychiatric conditions. Counselling psychologists, they also provide, assessment, diagnosis, and intervention to people with mild to moderate to severe conditions. Our researchers, you will find them researching topics of health, communities, other social issues that have an impact on, psychological well-being. And the research often forms part of policies or other interventions. Then our, industrial psychologists, yeah. So those psychologists are mainly involved with people and with individuals and groups in organizational settings. And I think, it's with a frame of improving organizational effectiveness. And lastly, our educational psychologists, they work with people to optimize functioning in educational or developmental settings. I hope that.
Yeah, no, that is quite interesting. Stacey, I also hear that you have a private practice. What is that all about, and what does it entail? What do you do there?
Okay. So because I work part-time at UWC, I have the space I've had the space to start up and invest in a private practice. Last year, January 2019, with the motivation of my husband, colleagues, friends, family, and my own therapist, I decided to take the plunge and start up my own private practice, which is based in Kenilworth. It was a really anxiety-provoking process, but also, exciting, and it's been quite fulfilling. So in my private capacity, I attend to older adolescents, say from the age of 15 and older, so older adolescents and adults. I see individuals, I do couples work, and I also do group sessions. And some of that has entailed, also working in a psychiatric clinic with people abusing substances and having other additional psychiatric conditions. So that's my private practice. And then I also do supervision for the South African College of Applied Psychology. And I do group supervision of fourth-year psychology students who are, out in the field and doing their practicals.
So you are quite a busy lady.
I am. I know it sounds like a lot, but I think just the benefit of, all of those streams being part-time, that has been quite helpful.
Stacey, and we know that substance abuse, and I know you are working with clients who are in that situation. Substance abuse leads to all kinds of other social ills, which in return can lead to increased levels of unemployment, domestic violence, child abuse. And that is a sad reality, especially in most of our communities in and around Cape Town. And we are faced with this on a daily basis as teachers. And we actually see the manifestations thereof in our classrooms. How can teachers benefit from what you are doing and from what you can teach them?
You are quite right, I mean, just with the ban of alcohol being lifted on Monday, we've already read and heard that, our trauma units have been, been busy with people having abused alcohol. So yes, there's a definite link between substance abuse and the impact of, the impact on our children, specifically the mental health impact. We know because of substance abuse and kids living in homes or being exposed to parents, other adults or other caregivers abusing substances, these kids are at increased risk of neglect, of violence, compromised health, psychological issues like depression, anxiety, but also academic decline. And we know that our teachers are exposed to this, with school being the second home, and children spending, a lot of time at school. These issues can then obviously manifest in the classroom, whether it be in the academics or emotionally or behaviorally with other kids. And I suppose our teachers are quite aware. It's a lot of holding. The teacher has to be, the actual teacher, but also that support network for the kids. And I think, it's really just about teachers maybe providing the necessary support to kids, that is within your limits. And also intervening by, contacting the school or the educational psychologist. Some schools have their own private psychologists, social workers, and referring kids on, that you feel are really struggling.
Speaking of which, a lot of our teachers are currently struggling to cope during these pandemic times, having to adapt to a new normal of engaging with their learners, not knowing whether their learners are actually engaged, let alone coping with the trauma of going back to schools and fearing contracting the virus. Are you considering providing any online virtual support to teachers specifically who might need your professional service, and also maybe parents who are traumatized? Because I know of quite a few parents who do not want to send their children back to school because of that fear within them. And so what can you do and what can you tell them?
Yeah. Dr. Issa, I think it's a very tough decision, whether to, for parents, whether to send their children back to school or not. And, just in terms of our teachers, I know that there's been an immense amount of pressure placed on teachers, having to suddenly adapt to new methods of teaching. And I think our teachers have had to wear many different hats, being the academic support, being the emotional support, but also having, pressure from the department, and then also just having their own families and having to attend to families and having possibly homeschool their own kids. And I think many teachers have gone over and above of what is expected of them and what they usually do. And of course, parents as well, just having that difficulties, that anxiety, that uncertainty, being angry at government, possibly feeling as if their voices are not being heard. If we just like what has happened recently in terms of the minister, the uncertainty with schools opening and not opening. And of course, this has been very distressing for learners as well, apart from the academics, but not being in close proximity with their teachers and their classmates. So there's that social aspect as well. So yes, I am working online at the moment. I am doing virtual therapy or teletherapy is what it's called. At UWC, we are still offering services to our clients via various online platforms. But in my private capacity, yes, I am seeing clients online via various social platforms.
Oh, that will be fantastic. And thank you, Stacey, for rendering such an essential service. I will most definitely share your details on the screen with our viewers at the end of today's show. And thank you so much for agreeing to talk to us here. And I think, like I said, it's such an essential service for us because we go through so many phases of, mental issues. And to know that someone is out there who knows and who can assist is really, really good. Thank you so much, Stacey.
Thank you, Dr. Issa, and you keep well.
Thank you.